Hello, everyone, and welcome back. Today, we're turning to E. Richard Brown's groundbreaking book, Rockefeller Medicine Men, Medicine and Capitalism in America. Let's start with the big picture. The crisis we face in healthcare today isn't a recent development. It's deeply rooted in the history of modern medicine and corporate capitalism. Back in the late 19th and early 20th centuries, the medical profession was struggling. Doctors were often seen as ineffective, and the profession was plagued by infighting and competition from other healing traditions. But then something shifted. The rise of scientific medicine provided a way out. Physicians and researchers began applying scientific methods to medicine, and this new approach promised more effective treatments and a way to distinguish themselves from other healers. But here's the catch: scientific medicine required resources far beyond what individual doctors could provide. It needed hospitals with state-of-the-art equipment, research laboratories, and highly trained specialists. Enter the wealthy capitalists. Men like John D. Rockefeller and Andrew Carnegie saw an opportunity. They recognized that investing in medicine could serve their own interests by creating a healthier workforce and legitimizing their wealth and power. But it wasn't just about charity, it was about shaping medicine to fit the needs of a capitalist society. Rockefeller, for example, was initially skeptical about scientific medicine. He was a follower of homeopathy, a competing medical tradition, but his chief advisor, Frederick T. Gates, saw the potential of scientific medicine to transform society. Gates was a former Baptist minister turned businessman, and he became the architect of Rockefeller's medical philanthropy. Gates was a master strategist. He convinced Rockefeller to invest in medical research and education, but he also had a vision for how medicine should be organized. He believed that medicine should be centralized, rationalized, and controlled by experts. This vision led to the creation of the Rockefeller Institute for Medical Research, which became a powerhouse of scientific research. But Gates didn't stop there. He also played a key role in reforming medical education. In 1910, he supported the publication of the Flexner Report, a scathing critique of American medical schools that called for sweeping reforms. The report recommended closing down proprietary medical schools, which were often seen as low-quality and profit-driven, and promoting university-affiliated schools that emphasized scientific research. The impact of the Flexner Report was profound. It led to the closure of many medical schools and drastically reduced the number of doctors being produced. This in turn helped raise the social status and incomes of physicians. But it also had a darker side. The reforms disproportionately affected schools that served poor and minority communities, leading to a decline in the number of doctors serving those populations. Meanwhile, the Rockefeller philanthropies continued to push for the dominance of scientific medicine. They supported the full-time plan, which required medical faculty to devote themselves entirely to teaching and research rather than maintaining private practices. This was a controversial move that pitted academic doctors against private practitioners. The struggle over the full-time plan exposed deep divisions within the medical profession. Academic doctors, particularly those in laboratory sciences, saw themselves as the vanguard of scientific medicine. They believed that medicine should be a science, not an art, and that clinical faculty should be focused on research and teaching. Private practitioners, on the other hand, were concerned about losing their autonomy and the financial benefits of private practice. Despite the resistance, the full-time plan was eventually implemented at many elite medical schools, thanks in part to the financial support of the Rockefeller philanthropies. This shift further consolidated the power of academic doctors and medical scientists, who became the new elite in the profession. But the influence of the Rockefeller philanthropies extended beyond medical education. They also played a key role in the development of public health programs both in the United States and abroad. Gates and his colleagues believed that improving public health was crucial for the stability and productivity of capitalist society. They saw medicine as a tool for social control and economic development. For example, the Rockefeller Sanitary Commission, established in 1909, aimed to eradicate hookworm disease in the southern United States. The Commission's efforts were motivated not just by humanitarian concerns, but also by the belief that a healthier workforce would be more productive and less likely to engage in labor unrest. As the 20th century progressed, the influence of the Rockefeller philanthropies and other corporate philanthropies continued to grow. They provided critical funding for medical research and education, shaping the direction of medical science and the organization of medical care. Their influence was felt not just in the United States, but around the world. But the story doesn't end there. The rise of technological medicine and the increasing capital intensity of medical care created new challenges. The cost of medical technology skyrocketed, and the medical profession became increasingly dependent on expensive equipment and facilities. This, in turn, led to the rise of powerful medical industries like hospitals, insurance companies, and pharmaceutical companies, which became major players in the medical marketplace. Today, the medical industrial complex is a major force in American society. It is driven by the same forces of capitalism that shaped the development of medicine in the early 20th century. And while technological advances have brought many benefits, they have also contributed to the rising costs and inequities in the healthcare system. So where does that leave us? The history of American medicine is a complex and often troubling story. It's a story of progress and innovation, but also of power, privilege, and the pursuit of profit. As we face the challenges of healthcare today, it's important to understand this history and the forces that continue to shape our medical system. Thanks for tuning in to this episode of BrightLearn. I hope you found this exploration of the Rockefeller medicine men and the history of American medicine as fascinating as I did. If you enjoyed this episode, be sure to subscribe and leave us a review. And join us next time as we continue to explore the stories that shape our world. Until then, keep learning, keep questioning, and stay curious. This has been a BrightLearn video from BrightLearn.ai on the book Rockefeller Medicine Men, Medicine and Capitalism in America by E. Richard Brown. Visit BrightLearn.ai for more fascinating videos like this one, and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.